On the LaMarca Law Group Newsmakers line to talk all of this over with me, integrative medicine physician and the fourth generation owner of the West Clinic. It's Dr. Jason West. Dr. West, welcome back to Iowa Radio. Good morning.
Good morning to you, too. And, you know, Sammy Hagar and the other official, they're not alone. There's so many people just not knowing what to do. There's so much misinformation, and I think it's just hard on everybody.
Dr. West, that's exactly why I wanted to talk to you this morning, because you and I have talked about this before, and you've said my patients are getting bombarded with information about this, a lot of times conflicting information, and they don't know what to do. Are you still seeing that, Dr. West? Are your patients confused about what to believe in regard to COVID-19?
You know, I think more and more of them are starting to get angry. And they're angry at the misinformation, not knowing what statistics to follow. And certainly in my area, we have some infections, but it's been very, very mild. We've been fortunate in that regard. And more people are thinking that the statistics that are being reported in the media may not be accurate. I think that's the biggest undertone of the discussions is people are like, I just don't know if this is really happening or not.
So Dr. West, you're a practicing physician, so I want to go to you and say, what's the most important for information about this? What do I need to know? If I'm in your office and I say, Dr. West, I am just so confused by everything that's getting reported these days. What do I need to know? What do you want me to know as a physician?
I think what I would want you to know is it's your immune system that is so important first. And if your healthy immune system, I mean, you look at the statistics, 99% of people are going to be fine. And what differentiates between someone getting sick and someone that's healthy is their immune system. So I'm going to that first and saying, look, good air, good water, good sleep, vitamin C, zinc, vitamin D3. We know vitamin A protects the mucous membranes against the virus. I want you to do that first. I want you to manage your stress levels as best you can, because stress is not a disease. It just makes everything worse. And then I want you to follow the social distancing guidelines of 6-foot radius, washing your hands, avoiding people that may have the COVID-19. But the reality is we're all going to be exposed to this at some point sooner or later. And if your immune system's healthy, it's going to process it just like other bacteria, other viruses, other parasites, and stuff like that.
And going back to what you were saying earlier, Dr. West, because this was an important point I wanted to make today. We keep hearing in the national media spikes. But I thought hospitalization and death numbers early on, that's what we were being told. Those were the important numbers. That's what we were working on. Do you think there has been a shift in how this coronavirus outbreak is being reported nationally, and that's part of the confusion?
Well, I do think that. And matter of fact, on the CDC website, it says, what do your results mean? If you test positive, a positive test result shows you might have antibodies from an infection with COVID-19. However, there's a chance the positive result means you have antibodies from an infection of virus from the same family of viruses called the coronavirus family, such as the ones that causes the common cold. So I think you're seeing these infection rates because we're testing more people are showing antibodies. But as you pointed out, I think the death rates are the most important statistic to be looking at.
And Dr. West, isn't it true also, because what I've been doing, and I've been advocating this to my audience, Dr. West, is to look at local media, because I think local media, they don't do the big, apocalyptic headlines. They do try to dig into it. One of the things I'm reading is we are learning more and becoming more effective in treating COVID-19 too. That, like, hospitalization numbers, for example, are going down because our hospitals are being smarter about how to treat it. Do you see that in the medical field?
Well, I think so. I think that's really good advice, to pay attention to the local sources rather than the media sources, the national media sources, because what's happening in Texas or what's happening in Florida may not be applicable to where you live. It's nice to know kind of what's happening, but I like that advice of, hey, pay attention. And I do think that they're getting more effective treating it. And I also think that just because you have a positive coronavirus test doesn't necessarily mean that it's COVID-19. I mean, even the data is saying that it could be antibodies to the 4 or 5 different strains of the coronavirus that causes the common cold.
Dr. West, this is why I love talking to you, because you're not a politician, man. You're a doctor. And so you also said something that the politicians don't want to say. Chances are you probably are going to get exposed to this, right? I mean, there's no vaccine. We have no cure. We're just trying to manage exposure to the virus, but it's going to stay out there, isn't it?
It is. And, patients ask me all the time, Dr. West, how can I avoid getting bacteria? How can I avoid getting a virus? How can I avoid being exposed to, stuff that makes you sick? And my answer is, well, let's put you into a plastic bubble and seal you off from the outside world, and then you're probably not going to come in contact with it. Now, that's not reasonable and that's not feasible, but how our bodies and how our immune system works is every single day we are being literally bombarded with bacteria and viruses and fungus and amoeba and algae and mold and yeast and fungus, and all of those organisms are trying to survive. They try to survive by eating something. How we survive is our immune system is always at war against those guys. So if you go back to personal health, keeping your immune system healthy, reducing inflammatory foods, reducing your sugar intake, which is horrible for your immune system. I mean, the higher your sugar levels are, the less amount you are able to ward off infection. And it's sometimes it's just going back to the basics. Sleep, enough water, which helps to lubricate the mucous membranes, healthy and alive foods, avoid foods that are pre-processed, pre-packaged, synthetic, reduce your sugar intake. I think that is where we're losing the battle in some common sense stuff, and we're getting caught up in this political drama of who's wearing a mask, who's not wearing a mask, is it a violation of your rights or not. Let's just focus on getting people healthy, and it starts with your immune system.
There you go. Integrative medicine physician and the 4th-generation owner of the West Clinic, Dr. Jason West, speaking some truth this morning. Dr. West, always enjoy talking to you. Have a great day. We will talk again on this topic, I am sure.
Nice to see you, Jeff. Goodbye.